say thank you to Dr. Elena Narova and Andy for making it possible for me to be here today. Thank you so much. My name is Victoria Cosmos. I am the founder of Hope for the World Foundation in Nigeria. My assignment is to tell you the success story of our foundation. But you may not understand the success story unless I give you a very clear background of the history of older persons in my country, Nigeria. I come from what you call the third world, where the typical older person has very limited or no care whatsoever. Age should be advantage, but as different as black is from white. That's why I put this on today. As different as black is from white. That is how the older persons in your part of the world are different from our old persons in our part of the world. So when I try to talk to you about the little I've been able to do in the past 10 years in what is now called a success story, you may think it is small, but looking at the background we're coming from, for our people, it is a lot. Age should be advantage, like I said, but in my country, it is disadvantage. I'll give you a quick background. On January 26, 2018, our president signed the Senior Citizen Center Bill. 2 years after it was signed and introduced to the House of Representatives, Nigeria has almost 9.6 million elderly people, aged 60 and above. However, since signing into law, nothing has been heard about this promising legislation or plans regarding its implementation. Nigeria, according to the Global Age Watch 2014 ratings, is the 12th worst country to grow old in the world. The 12th worst country to grow old in the world, following these statistics based on income security, which is nil, when they have worked for all their years, either in civil service, when it's time for them to begin to take their pension and leave, they are denied of their pension. So they have no money in their old age to feed, to pay their rent, and to take care of their basic needs. Secondly, they are disadvantaged in their health status capability. There are no designated hospitals that take care of older persons. We have very few gerontologists and people who care specially for the elderly people. So when they go to the general hospitals, they wait on a very long queue before they are attended to, and that is another disadvantage. And the third disadvantage is lack of an enabling environment. We don't have anything assigned for the elderly. When an elderly person wants to cross the road, nobody stops for you to cross the road. You have to struggle like the very young people in the country. So based on very few of these things I've mentioned, I would now tell you what our foundation has been able to do since 2010 till date. I will now go to my presentation. Shall we go to the first page? Okay. In 2012, I opened a center on a very public road in a highly populated local government called Alimosho. It's the most populated local government in Nigeria. And I put up a big signboard and I said, free food for the poor, because we had to attract them with something. My desire was to bring them out of their poverty and their problems and give them a place where they can come to every day. Because we recognize that for you to meet their needs, you need to bring them to you. We cannot go to all of them in their houses. So I opened the center and they started coming every Thursday since 2012. We have been taking care of over 2,500 elderly people from 60 years and above. And what do? We give them healthy food, physical exercise, entertainment, and then we recognize international holidays like the International Day for Older Persons of the United Nations. We teach them that they are old, but they are young at heart. Let's go to the next page. Nigeria's demographic profile puts the number of people aged 60 years and above at nearly 6 million as at 2017. As at today, it's 9.6 million. More than 70% of these people in Nigeria, especially are in the rural areas. They are not suitably integrated into the society or adequately cared for. The next page. So our solution, we are advocating for better care policies that cater to the needs and integration of elderly people in the country. And what I'm doing presently is building centers. I am building, now we don't have any government support, so if you want to do anything for anybody in my country, you need to do it with your own funds. So what did I do? I have 1 or 2 properties which I sold, and from the proceeds of the sales of my houses, I have started building small halls in different communities where every day they come, they have fun, they play games, they do physical exercise, and they go back home. And somebody asked me, Victoria, why don't you open an old people's home, what you call care center here? Yeah? You call it, what do you call it here?
Residence.
Yeah?
A residence.
A residence. No, we can't do that. I can't do residence in my country because I'm limited by space. I'm limited by funds. And I can only take care of probably 10 old people if I open a residence. But the need of 10 million people is beyond opening a small room to take care of just 10 people. So I opened a big center where people were coming from all walks of life every Thursday, and they were taken care of. What we have noticed in these few years, which is like 8 years, is that what causes early death, diseases, sickness in older persons is not physical, it's not medical as it were. That's my experience. I'm on the field. You are scholars, you are medical people, but from the experience I have had, what kills them in my part of the world is loneliness, depression, no hope for today, not to come of tomorrow, a very bleak future. You don't have your children around you taking care of you, and you wake up every morning with nothing to keep you alive. So we gather that if we can tackle those factors, then we can add value to their lives. So they come to the center every day. They wake up with a sense of achievement. Oh, I'm going for, they call it old school. They say, I'm going to old school, old school, old school. And when they get there, I don't even have to be there. We have our staff, we have our coach who takes them through physical exercise. They have fun, they do beauty pageants, we do makeup, we do drama, we do musicals, we do a lot of activities that make them happy. And after 2 or 3 hours, we have closed, and they go back to their homes. Now you ask me, how do we take care of their needs? Some of them cannot pay their rent, so we give them the money to pay their rent. Some have no clothes, we give them what we can give them. And as you will notice, there's only very little that an individual can do. But somehow we have been able to do this for the past 10 years. So these are some of our activities: physical fitness, healthy feeding. We pay a lot of attention to what they eat. Medical care, we do tests for them, their glasses. You can see some of the fun activities. The counseling session is when we talk to them about, some of them have so much money or properties, and when they die, their children don't know where their properties are. So we teach them about writing your will. How do you write a will? We get lawyers to talk to them, how to get their will written and executed after they die. And then we have family reunions. There's something very special that I've noticed that keeps them happy and alive, and we call it Celebrate Alive Day. In Africa, when somebody dies, it's celebrations. An old woman that has not been cared for all her life suddenly dies, and then you see us, we do this, and we do this, we wear the clothes, and we kill cows, we kill rams, and we do parties. You bring flowers to the graveyards. We don't, we do parties. So in the foundation, I teach them, don't wait for your children to do parties when you're dead. Let them do the party for you now. So we call it Celebrate Alive. So we tell the children once, 1st October every year, come to the center, come and celebrate your parents alive, not when they're dead. So you can see here, that's one of the pictures. The children come with gifts, they come with money, and they come to celebrate their parents alive. So that's, next stage. Okay, like I said, because it is not a living center, till date we have data of almost 2,500 people that have passed through. And I can say categorically that from this number, only 4 people that I know of have died since we started the program. Just 4. They become younger, they become more beautiful, they become more active when they come to the center. When you say, hello mama, she will say, I am young and beautiful. Let me do the drama with you, sorry please. So she's 80 years old now. And I say, hello mama, how are you doing? What do you say? No, you say, I'm young and, I say, I'm young and beautiful. Yeah, that's what mama says at 85. Thank you. So we teach them that they are young and they are beautiful, even at 90, at 100, and at 120. So here we have 3, the woman up there, we call her Mama Moliki. She's 180 years old, she's still alive, and she dances a lot. You can see her with me dancing there. And so we have 3 communities in Lagos now. We're building the center. Well, my government has recognized what I've done, and I've received many awards in Nigeria, but I dedicate it to the old people that I care for. And I go around the world learning best practices in aging. I told Anda I would like to do my master's, postgraduate in aging and vitality, because all I've been doing for the past 10 years is out of passion. I still need to acquire the educational qualification to do what I do better. So I hope I'll be able to work on that before I leave. So these are our next steps. We need to establish what we have been doing for the past 10 years in such a way that we can leave something behind for posterity. So what we are planning to do is, that is our center that we're planning to build a state-of-the-art older persons care center in every community, develop and share a working template for elderly care, raise awareness and drive media campaigns that promote the need for elderly care, expand our program activities to include skills acquisition and more. Yes. So next page. That's the center, and you can see at the back of this is a project for the future, and we will get there. next. And then as you can see at the back of their shirts there, they say old is cool. Old is cool. That is what they have been able to do at Hope for the Road Foundation. The community-based effort that we are embarking on is to allow us to take care of everyone as much as we can. I also discovered that the elderly people that are rich, in quotes, are able to take care of themselves better than those in poor neighborhoods because of lack of facilities. So our design and our template is to build more of those communities at rural areas so that we can help them live longer, healthier, happier lives, and thereby contributing my own little quota to the lives of the older people in my country. Thank you. Sandra just reminded me of some videos that we have on the. If you go to our website, you see most of our activities. Let's just from the beginning. Yes. Okay, that's Mama Moniki. When she was 107, we took her to the ophthalmologist to get her eyes tested, and we discovered that she had cataract. Yeah, she actually wanted to use glasses, but the doctors told her that with cataract she cannot use glasses, recommended glasses. So that is the test. So we gave her drugs to continue to take care of her eyesight. The next one. This was the glasses she was wearing before she came to the center. And as you can see there, she's holding a gift. We always give them gifts when they're going back home. So all she's doing that now, in Africa, they're very, very, okay. So what she's doing is she's praying, and yes, she's praying and she's saying thank you for this gift. And she prayed for almost 10 minutes. I don't think you want to hear the prayers for this. So this, you can see them. This was before we got our uniforms. We play games in the hall. I don't need to always be there. That's the beautiful part of it. And they have fun and they go back home. Okay, next one. And every anniversary, we celebrate every anniversary of Hope for the World, where we invite governments and parastatals and their families to come and watch them. She's a retired Major General. So she's remembering how she used to do it when she was in the army. Okay, next one. We teach them to dance, and we give them very healthy food. We notice that some of them are diabetic. We don't give those who are diabetic rice. So we are aware of their health status, and that determines what we give them. And please note, all these services are free. They pay for nothing, not even for membership. We don't collect any money from them for anything that we do for them. Next one. So some of our activities, you can see that's the hall. Sometimes we have like 100 people per day, sometimes 50. I join in their games. So we have outdoor exercises. We are conscious of the frailty of their health, so sometimes all they do is just walk. Even when they don't win, we tell them they win so they can be happy. Like if you watch this, Mama is 76. Of course she came last, but we gave her the award of the winner. You can see she couldn't even go as far, but she was declared the winner at the end of the competition. I think, yeah, this is a discussion segment. This is therapeutic because it enables them to remember the past, talk about their childhood, they do debates. So we allow them to do debates, activities that energize their brain. Okay, she's 82. She came to the center that she needed. She was homeless. And what we did was to give her a rent, to pay her rent. And here she's saying thank you to the foundation for paying her rent. We do this without any government support whatsoever. Now this is funny because that woman is 82 years old and she dances a lot, and she said that before she came to the center she was always sick. Please let it play on. Okay, sorry. She's 82. So they go back after doing all this and they are happy, and I believe that their state of mind actually affects their health. So this is a little that I'm able to do. I believe that as time goes on and as I am better equipped academically to at least take care of their health, particularly because some of them come and they have dementia, they have a lot of frailties, and I'm not equipped to do that. So I would like to be able to do that. I'll talk to Andy. I'm sure we'll get into some university so that I'm perfect in taking care of the health anymore. Thank you very much.